DrNarash Torres, a general practitioner based at the Lethem Regional Hospital, said he began experiencing mild symptoms associated with COVID-19 on Friday last. Earlier in the day, he and a team visited several villages in the North Rupununi region, where they collected 48 samples from persons for testing. Dr. Torres told the newsroom in a telephone interview that he had a bout of dry cough and insisted on getting tested.
I was swabbed last Friday after coming back from an outreach in the North Rupununi district, where we screened and swabbed 48 persons. I had decided to do a swab, but actually I insisted that I was swabbed because I was having a dry cough, and I was concerned. It was getting worse with time, so I requested to be swabbed, and on Saturday evening I got back my results and it was positive. Sunday evening, Sunday.
Okay.
After lunch.
His symptoms have since increased with a mild headache and nausea. The general practitioner was among 38 new cases recorded in Region 9 on Sunday. Though he has been working with positive patients for months, Dr. Torres said he had never expected to become infected because he was taking all the necessary precautions. However, Dr. Torres lamented the deplorable conditions under which doctors are forced to work and which he believes led him to becoming infected.
We have been taking precautions, yes, but the conditions in which we work under is not up to standards. For example, I was working in the isolation ward with the symptomatic patients, and the room where we would don and doff or put on our PPEs, the door could not have been closed. It was open into the ward with patients. So the AC was blowing into the room where we were supposed to get undressed and stuff. So I have a strong feeling that I got infected.
The newsroom understands that the isolation facility being set up at the Lethem Regional Hospital compound has not yet been completed. The facility will include an area for showering so that doctors can bathe after treating isolated patients. As a result of his positive test, several doctors and nurses along with administrative staff at the Lethem Regional Hospital have been placed on quarantine for testing. Dr. Torres is urging persons to take the disease seriously and to protect themselves. He noted that while persons in the town of Lethem are taking precautions, residents in the villages have not been adhering to the guidelines.
The struggle we're presently facing is in the communities, the Amrina villages, where the culture is unique. Everybody would hang out together. They would, maybe share. The culture is different, and also we got to look at the level of education in these communities. They have poor access to internet, no TV, hardly any radio and stuff like that. So to get the message to them is also very difficult. We had to also take into consideration the language barrier. The Region 9 is dominated by the Wapishana and the Mapuches. So that's another problem we have.
The general practitioner is also pleading with authorities to assist in blocking persons from crossing the border from Brazil, as over 90% of the region's cases are imported from Brazil. Regional Chairman Brian Alicog told the newsroom during a telephone interview on Monday that there is a shortage of food and sanitizing agents and, most importantly, limited health workers in the region. Bibi Katun reporting for the newsroom.